Hello, everybody. Welcome to Understanding the Human Condition. I'm your host, Dr. James Flowers, and I'm so excited to have Claudia Schwartz with us today. Claudia has worked with us for about 2 years here at J. Flowers Health Institute, and she is the Vice President of Clinical Outreach, and she really covers the world, but her main priority is covering the United States. And Claudia, you recently had a trip to Switzerland and Italy and Spain, and you had to cancel it. I'm sorry.
I did.
And we're going to talk a little bit about that today.
Yes.
And why you canceled that trip. And so first of all, sorry you had to cancel. Those are all incredible places. I know you'll get to go again soon.
Yep.
But the first thing I wanted to do is just have you introduce yourself to our amazing audience.
Sure, absolutely. Well, so I've been a clinician for many years. I'm a marriage and family therapist. So I had a private practice, long time, almost 20 years. And from there, I decided to go into consulting, therapeutic and educational consulting. I became a professional member of IECA so I could really understand the different levels of care and just different programs and resources for families across the United States. So I did that for several years, which is how I got to know J. Flowers Health Institute from our firm and when they referred clients here. So I already knew how amazing this institute was. And so when you all reached out to me, hey, would you like to try clinical outreach? At first I thought, well, that's really, I'm a therapist, that's my background, and a consultant. So what would my role be? And to really have the opportunity to talk about what we do, share what we do from a clinical perspective was an amazing opportunity. And I'm so grateful because I've been here 2 years now and absolutely love what I do. Love being able to share the message.
And we're so happy to have you because you do an outstanding job and you represent J. Flowers Health so well. And thank you for that. What got you into the field? I know you have a husband he's a surgeon, I believe.
Dental
Surgeon.
Yes.
Yep. And you have beautiful children. Tell us about your family and really what made you become, how'd you decide to become a marriage and family therapist?
Sure. So my husband, we've been married almost 30 years. We have a 19-year-old and 25-year-old boys. And so years ago, my background was in neuroscience, and I thought I just wanted to be a researcher because I was so interested in biopsychology and how the brain works. And then really my husband and I had some difficulties having children. And so through some tragedy of that, we ended up in a marriage and family therapist couples counseling session. And just because it was so difficult of a time for us and sitting there, she really helped us see that we were more on the same page than we realized. We were just coming at it from different directions. And she was able to help us heal and figure out how to move forward. And it was actually my husband who said to me one day, he was looking around her office and he said, you should be doing this. You're so great with people and you love the one-on-one, you shouldn't be stuck behind the desk and just on the computer all day. And it just sort of shifted my focus because I hadn't thought about it before. But that day in that office, I said, you know what? I do want to do this. I want to help somebody the way we were helped by this person. So that marriage and family therapist is what started me on my journey, and I never looked back.
Yeah. So many of the mental health professionals that that I know really in our field, even in the world of addiction, are in their field because of their history. So you had a natural egress into marriage and family therapy, and that's amazing. And then how did you go from a clinician to being an educational consultant?
Well, I ended up moving. So my private practice was in Las Vegas. And when my father-in-law died, we moved to LA to be closer to my husband's mother and take care of her and that kind of thing. And when we made that shift, I didn't want to start over again and start a brand new private practice. And someone offered me the opportunity to go into consulting. And I thought, well, this is great because I can use my clinical background, but it was something new and different. I love a challenge and really felt like it was time to reinvent myself a little bit. And that's how I started the consulting world.
Sure. Great. And you were an amazing consultant because we got to work with you here at J. Flowers Health Institute and referred back and forth. And that was a great experience. And then you came on as business development.
Right.
And you were had some trepidation about that.
I did.
And we said, oh my gosh, you're going to be amazing. You're going to be brilliant. And you have been. For the last 2 years, really, you've traveled the world, mostly the United States, doing business development. Talk a little bit about your experience in doing what you do in business development.
Absolutely. Well, my whole goal is to bring the message of what we do to people who haven't heard of us, people that have heard of us or that work with us to strengthen those relationships. because for us, we're all about collaboration. We want to work with other programs. We want to work with other clinicians side by side so that we can all service the clients the best way that we can. And I really enjoy meeting new people. I enjoy hearing different perspectives on how to treat people because it's not just a one size fits all. We look at so many different avenues of how to help someone, and we're such a holistic approach. And not many programs are like that. And there is, I take pride in saying we're the only medical and mental health model diagnostic evaluation program in the country. And we do it really well. And that message needs to get out there to people. So I love when I can go in and have someone say, oh, we haven't heard of you. And say, well, let me tell you, let's sit down.
Absolutely.
But at the same time, my philosophy is always to get to know the person first. I don't jump in and just start talking about what we do. I want to know, well, where's this person coming from? What do they do? And how do they, how would they respond to us? But also, can we use them as a resource? And we always want to know good professional people who are at the top of their game, just like we are. So that's the fun part of the job, is being able to just meet with a lot of different people. And I enjoy that so much. I love the traveling, and every part of the country has its own culture. And that's interesting too, because when we have so many diverse clients coming to us, we need to know, well, where's the best next step after they leave us? And it's important to get to know those people and places.
Absolutely. What's the next conference that you're attending?
The AIS conference is next week. AIS is the Association of Intervention Specialists, and it's in San Antonio next week.
Oh, cool. That'll be easy drive or flight, either one. Are you going to drive
I'm driving
or fly?
over straight from here.
Yeah. Gosh, this is the first year I haven't gone to that in years. That'll be a great conference in San Antonio. And then after that, I think, are you going to Seattle?
I am to the IECA is the Independent Educational Consultants Association.
Yes.
And that's taking place in Seattle, where you're presenting.
I am so excited to get back to Seattle. I haven't been there in quite a while, and I spent, as you know, a long period of my life there.
Yes, you did.
And it's an amazing city, so I'm looking forward to being back and seeing all of our friends up there and doing that conference together. That'll be great.
It will be.
And, Claudia, if you don't mind, I'd love for the audience to know about your own personal experience in health. You're an amazingly healthy woman. You work out, you go skiing, you run, I think, you do all types of physical activity. You're in great shape. And yet you recently had a medical complication that was a very out of the, completely unknown arena, correct? Right. And so tell our audience what happened and kind of your experience and what you've done.
Sure. Well, it's interesting because I am very health conscious. And so I go to the doctor, I get my yearly exams, I do everything proactively that I possibly can. And so recently I went to see a cardiologist because, the age I'm at, I thought, well, I need to check and make sure my heart is okay. Let's see where we're at. And he put me on a heart monitor. He had done EKGs and everything looked very normal. But again, proactively, let's just make sure because there's some heart disease in my family and we wanted to make sure I was where I needed to be. So I wore a heart monitor for a week, and I was at a conference in Aspen, had been skiing all day. I won the NASCAR ski race in my age group. I had a phenomenal week. I'm at 13,000 feet.
Vigorous exercise.
I
at
was
13,000 feet in Aspen.
And I could breathe great. So many people around me were, passing out. They couldn't breathe right. It was difficult at that high altitude. And the cardiologist called me 8:30 at night, and he said, I got the results from your heart monitor, and we have some grave concerns that your heartbeat has been stopping. And one was for 6 seconds, one I believe was 11 seconds. And he said, that's on the verge of passing out or worse.
Sure.
And he said, you need to get back to LA and we need to put a pacemaker in you. Wow. Those were his exact words. And this is coming from a top surgeon at Cedars-Sinai in Los Angeles. And right away,
that
the anxiety
crept in.
It did. It did. My husband as well. He was with me, and the doctor was on speakerphone. And my husband, who's a surgeon as well, he said, well, wait a minute. They want to put a pacemaker in right away. So we came back, and they actually had my surgery scheduled before I even had the consultation with the cardiologist.
Wow.
And I said, I'm not doing it until I speak to the cardiologist, which I did. My husband also accompanied me to make sure we had a second set of ears listening. And they said, well, this is what's happening, and we need to do that because we don't want you to, to die, basically is what they had said to me. And of course, my trip to Europe was supposed to be 2 days later. Yep. And so I said, this is an emergency. And they said, yes, you need to have this right now. And it just didn't sit right with us because we asked, well, shouldn't we be doing some other testing? Should we do an MRI? This was our question. Should we do? No one offered that to us. They just wanted to have me go under the knife. And my husband said to me, you need to call Dr. Flowers. And he said, you work for J. Flowers Health Institute. I think that's where you should be. And of course, I called you immediately in tears and upset. And you said, no, get on the next plane, come to Houston. You need to see our doctors. And so my husband came with me. I was here for 2 weeks as a client of J. Flowers and got to be exposed to the most amazing professionals. I had already known how great they were based on our clients and mingling with them and getting to know some of these specialists. But the care that I got here was, I can't even say second to none. There's just nobody else that could give this care, I believe, because from the very first day when I saw the cardiologist, he, after spending an hour with us, talking to me just about history and this and that. And this is the actual cardiologist, not just the nurse, which is usually what happens. He had the phone picked up. He was calling the next specialist saying, okay, you need to go down the street to, it's another hospital, but this specialist should see you. I had testing lined up. I mean, it was just 2 weeks of constant testing and monitoring. They left no stone unturned, as is what we do here at J. Flowers. And as it turned out, he said, you have a very healthy heart. We can't really explain what's happening with these pauses in your heartbeat, but it doesn't warrant having a pacemaker right now when we're not 100% sure. None of them felt good about it. And I watched them all collaborate with different specialists to make sure that they were doing the right thing by not putting the pacemaker in. And as it turned out, I flew home after 2 weeks. They put me on a live monitor so that they could just monitor me for another 2 weeks.
Let me pause you for just a second, if you don't mind. So it went so far, and I want to give out a shout out to Dr. Emerson Perrin, your cardiologist at Texas Heart Institute, which is amazing. He is the cardiologist of choice for us at J. Flowers Health Institute. He's absolutely brilliant and amazing, has done a phenomenal job with you and aligning you with the right heart specialist to do each test that you had. And I think that it went so far as you were actually on the operating table at one point, and they were putting you under anesthesia. And they stopped.
They did.
And the surgeon said, I don't feel comfortable moving forward with a pacemaker today. I want to run more tests.
Exactly. And that was after I'd already had a boatload of tests. And we had decided collectively they wanted us included in this decision making. They said, you meet the criteria for a pacemaker, but you're a strange case. It does and it doesn't, just because the rest of my heart was so healthy.
Muscular, healthy.
All of that. No clogged arteries, no sign, nothing enlarged, nothing, no sign of heart disease. Everything just looks at my heart. My blood pressure is very low. So, and that was another key thing too, is that I've always had low blood pressure, but they said this is really truly a little bit too low. So let's work on this and maybe see if that's maybe not part of the cause and what can we do about that. So they're looking at other avenues. But at one point they said, well, if we want to be really safe, let's do the pacemaker. So I was scheduled, I was on the operating table and all of that. And I'd finally wrapped my head around it. Okay, I guess I'm going to have this now. And he pulled back and he consulted with another doctor, actually in another state even, another specialist, in addition to the specialist here in Texas, just to make sure. And they all agreed, you know what, let's do more testing. Let's wait it out. Let's pause. So I wore that live monitor for 2 weeks. I just came back this week on Monday. I had a minor surgery that implants a permanent heart monitor in, which is what I have right now. Much less invasive, but they can see it in real time and know that if I have episodes or it becomes dangerous, I will be right back on a plane here to have a pacemaker when and if I should need it. Because he said it's possible that you may only need this if those pauses never get more than 3 to 5 seconds.
Absolutely. And you have is it an app on your phone?
It is an app on my phone. The technology is amazing. I spoke to a few I consulted with some cardiologists too, and they said that is very cutting edge what you have. So it is a real-time monitor, and they will know instantly if something's going awry with my heart.
Absolutely.
As will I.
All right, now here's my concern. Have they cleared you to drive yet?
Yes, they have. Now they have. I hadn't been before. The last 2 weeks were rough not driving. I'm very independent, especially living in LA.
That's got to be, in LA, you have to drive.
It was not easy, no.
It's not like you're in Boston or New York City.
Nope. No, now with this monitor, I should be able to do just about anything. They told me I could get back to, I can ski, I can run, I can do all of those things.
Amazing. So if something were to go wrong, it alerts you and the physician at the same time.
Exactly.
That's fantastic.
Yes.
So with all of that said, you know, what we talk about oftentimes on understanding the human condition is the human condition. So here you are, this amazingly healthy woman living your life, and all of a sudden you're told in California and Houston, you may, or in California, you need a pacemaker. Here, we're looking at a pacemaker, right? How did that affect your mental state?
It was so hard because I just felt like when I think about pacemakers, I think about grandpa with his cane.
Right,
And
yeah.
I know that's, there are people that are in their 20s that need a pacemaker
Right.
because their heart is not working well. But usually that's somebody with significant heart disease or possibility of having a heart attack. And feeling that, it just stopped me dead in my tracks because I thought, how is this possible that I suddenly have this? And it was so debilitating mentally for me. I basically shut down. I was a zombie, I
Sure.
think, for 2 weeks walking around. And that's why
I can't imagine.
I was so grateful to have this supportive environment, because without that, I don't know how I would have gotten through it, honestly. It was really one of the most challenging things, facing my mortality all of a sudden and wondering, like, how did this happen?
Right. I'm sure
So
you and your husband had many conversations.
many conversations,
Yeah.
many.
And your children, probably.
That too.
Yeah.
They were also very worried. They're still worried. They're a little less worried now that I have the monitor. They're
Right.
feeling better about it.
Good.
But still, it's just disconcerting because when you have a disease or something that progresses, you can follow it and you're a little more prepared. But when it suddenly just out of nowhere comes that, hey, this is what you may
Right.
have going on, it was
Yeah.
very hard.
Yeah.
Still is, but better.
Yeah, absolutely.
Better.
Good. Yeah, you seem to be doing so well. You feel better. You sound
do.
great.
I
And
feel much better.
we have a hectic week here this week, and
Yes,
you're
we
keeping
do.
up with everyone and running
Trying
circles
to.
around all of us.
Trying to.
I just want to say thank you so much for being willing to talk about your heart. I don't want to say heart condition, but your heart
Understand,
moment
My heart
that you've
moment.
had. That's right.
That's
We'll
right.
call it a moment in
That
time.
sounds good. Yep.
Absolutely. And I'm sure it's going to be fantastic, and you're never going to have a pacemaker. And if you do, the technology is there, and
It is.
it's okay.
And I'm very confident now. I at least know now that if I do need one, I'm confident they're making the right decision and that, yes, I do need one. And I
Right.
think that's what will be much easier than
Yeah.
this uncertainty I had before. Well, wait a minute, you haven't even done
Yeah.
any other testing yet.
Right.
You want to go and do this. So
Yeah.
I have such confidence with the doctors here. I will not do it anywhere else. I will
Yeah.
do it here with these doctors who I know me well too.
Right.
I will say too, I've been sharing with people that the surgeon here, that he's the electrophysiologist that put this device in, Dr. John Seeger. I have to give him a plug because
Sure.
he's so amazing. After the procedure, he walked me down the elevator outside to where I needed to be, where my ride was picking me up.
Wow.
And I don't know a lot of surgeons that are going to walk out of any
Right.
operating room or anything and come and make sure that you're okay and that you're being picked up. And usually that's a nurse or something, but I feel like they are so hands-on, because every doctor was like that with me, every single one. I have all their cell phone numbers. I accidentally called Dr. Perrin
Oh,
one
no.
day because I was
fine.
panicking. I
Yeah.
didn't realize it was his cell phone.
Uh-huh.
And he said, no. He talked to me for 30 minutes,
Yeah.
middle of the day. I don't know what he was doing during that time. He didn't
Yeah.
hesitate to just, reassure me.
Walk you
and
through. Yeah.
yes, and answer questions, which that's why I'm happy to share this story with whoever will listen, because
Sure.
finally being a client of J Flowers and being able to express what it really feels like to
Mhm.
get this kind of care, it makes it more amazing to do this job. I feel like I can talk about it even better now because I've
Absolutely.
had my own experience.
Yeah, and you've seen the collaboration.
Yes.
You've seen, the Texas Medical Center started being built in 1962 on the mindset of cross-institutional collaboration and bringing in the top minds in research, science, and medicine in the world to the Texas Medical Center. And it truly is a center for excellence. And you got to witness what we do with the Texas Medical Center and the physicians in the Texas Medical Center, and witness really firsthand how that cross-institutional collaboration works. Dr. Perrin called me a dozen times over the last 2 weeks, right? Just to fill me in on how you're doing. And that was reassuring for me, both as your friend, right,
Right.
and working with you, to know that you're doing okay and that if something is necessary, he's there for you. But he kept us updated at J Flowers and what all of the other physicians were doing and how they were collaborating with each other and then ultimately with us.
Which is
So,
amazing. I just find it, and my husband, who has studied his medical practice in different countries where they have different specialties, he's an dental implant surgeon. So he said he's never seen medical care like this ever. And he's been to many top institutions throughout the world. He said just the way they communicate with each other and also the kindness and the human level,
right.
which you don't always experience either, particularly with surgeons.
Absolutely.
The bedside manner of everybody was phenomenal.
Yeah.
So
I'm so happy
Amazing.
for you.
Thank
And,
you.
and we'll end on letting everybody know that it's not just medicine that we
Hmm.
work with, of course.
Right.
It's medicine, it's
Hmm.
mental health, it's psychiatry, which is
Yep.
mental health, of course. It's addiction.
Hmm.
It's many, many, many things in the
Hmm.
human condition that affect us. And you
Exactly.
also notice probably through your journey here that one condition affects the rest of your body.
It sure
And if you
does.
don't fix one, the
Hmm.
rest of it's not going to be okay.
Exactly.
And so I'm so happy for you. And if you guys need help or looking for anything medically, psychologically, psychiatrically,
Hmm.
or anything else, reach out to us at jflowershealth.com, 713-783-6655. And Claudia, thank you so much for being here.
Thank you. It was
Yeah, you're
wonderful.
welcome. Yeah.